Boost your bone density with these 6 life-changing tips. I'm Hamza Aziz, the producer of the Talking with Docs podcast. You might know Talking with Docs from their popular YouTube channel. Strong bones are key to staying active. Here's how to keep them healthy.
Are you looking for ways to increase your bone density? Welcome to Talking with Docs. I'm Dr. Brad Wayne.
And I'm Dr. Paul Salza. I like our casual look in these chairs with backs on them.
Yeah, you got puppy dog eyes this morning.
We got a new puppy, right? So. But my wife is doing the lion's share of the work, so thank you very much for that.
You're welcome. So what we're talking about today is ways to increase your bone density. So as orthopedic surgeons, we deal with this all the time, particularly on the trauma side. So we see people with broken hips or hip fractures, and these are typically related to osteoporosis and the obligatory loss of bone that we see as we get older after about age 50 or so.
Yeah, wrist fractures, vertebral fractures, lots of fractures occur because of low bone mass.
Yes, and this is both in men and women.
Yeah, that's true. And bone is funny, because bone, if you use it, it's good. If you don't use it, you lose it.
Sure, and they even learned that through some of the space studies where people came back from being up in space for a long time with no gravity, and they're like, these guys have osteoporosis, what the heck?
Yeah, you know how much they lose in space?
It's a lot.
1 to 2% of your bone mass goes per month.
Per month.
And that's why I didn't become an astronaut.
I don't think that's the reason.
Yeah, you lose weight. And the thing about bone is that makes it respond to loading is Wolff's Law, right? Remember Wolff's Law? We learned that long ago, where bone just builds up when it's being loaded. Right. If it's not being loaded, it goes away.
And that's going to be an important principle of what we're going to talk about on ways to increase your bone density.
Right.
Yeah, so the first thing that I would say is you need to build a time machine and go back in time and increase your peak bone density. So unfortunately for anyone who's watching this video who's over 30 years old, your peak bone density is probably came and went.
Oh, I'm running out of time.
Peaks in women around 25, men around 30.
I got a few years left.
Yeah, so what you need to do is, for the younger people that are watching, is healthy diet, exercise, and for women, regular periods, because that helps increase the amount of estrogen in your body, and that has a specific role in bone. So increase your peak bone density as much as you can. But now for everybody else, we're going to talk about specific strategies, evidence-based strategies that have shown ways to increase your bone density and really maintain it. And we've talked about this before. Bone is like an active living structure. So it's not like a piece of wood that just sits there and doesn't do anything. It's constantly being turned over. So it's a battle in your body between bone making and bone resorbing. Right,
your osteoblasts are your bone cells that make bone, your osteoclasts are your bone cells that resorb bone. So it's a living, constant turnover thing.
And there are a host of factors that talk to these cells and tell them what to do. So when the scales are tipped in the favor of absorption, you lose bone density. And there are a bunch of things that do that. So we're going to talk about how to avoid those or how to optimize those. So let's start. Here we go. Top 6 ways really to increase your bone density. What is number 1?
Number 1 is weight-bearing exercise.
Okay.
So those are things like walking, jogging, standing, those kind of things. Avoid sitting, avoid lying, avoid going up into space. If you can.
Cancel the trip.
All right, if you signed up for the trip to Mars, think about it.
Or make it shorter anyway, make it less than 1 month, that's for sure.
I don't think you can. I think that's a long one-way journey.
I suspect.
With today's technology. But yeah, Wolff's Law says if you load bone, bone will respond by making more bone. If you don't load bone, it'll go away. Thank you, Wolff.
Right. And so simply walking, carrying your body weight does this. And we're going to talk a little bit about that whole 10,000 steps thing, where that came from in a separate video. So getting as many steps as is safe for you and is within your exercise capacity. But one thing that you can consider to adding to your weight-bearing exercise is a weighted vest. So a lot of people are like, well, I've told some people this week about this because we did some research. My patients are like, well, what's a weighted vest? It's literally a vest that has little pockets, typically that hold 1 pound weights. It ranges in weight typically from 5 to 20 pounds. You can buy them anywhere. And what this does is by putting this vest on, it simulates you weighing more, carrying extra weight. So and they've done some randomized controlled trials, and in that first year, wearing a weighted vest, somewhere in the 5 to 10% of your body weight, can increase your bone density 1 to 3%.
Yep. And it makes it really easy to lose weight.
That's it. Look at me, I just lost 20 pounds.
Easy.
Yeah, so consider a weighted vest. If you're going to do that, start slowly and just be careful. Obviously, you don't want to injure yourself, but there's good scientific evidence to show weighted vests actually work.
You've seen people wear the weights on their ankles and the wrists as well.
Yeah.
So weight-bearing exercise. That's number 1. Number 1 way to keep your bone density up.
Okay, number two is strength training. And a lot of people are like, well, what the heck? How does strengthening my muscles affect my bones? Well, your muscles are attached to your bones by tendons, and they pull on the bone through a principle called mechanotransduction. That signal of the pulling on the bone talks to what are called osteocytes, and it tells them, hey, let's start making more bone in response to this stress.
Okay, so what kind of strength training exercise are you talking about?
Okay, so there are randomized controlled trials that have looked into all different kinds of exercise, and I'd say the top 6 exercises are ones that are compound movements using very large muscles in multiple parts of our body. So number 1 would be squats, and I'd say across the board, this is the best exercise. It's great for your back, it's great for your lower body, both for your glutes and your quads. So squats, weighted lunges, and sorry, squats could be body weight squats, or you could be wearing or using dumbbells, or even using a bar. But
They will hurt if you have a meniscal tear, but
yes, we talked about that one in our other videos. So weighted squats, lunges, leg press, overhead press, and rows. So bent over rows. And these are all things that really are working on our back and our posterior chain and our core.
Okay, and same thing, right? Bone wants to be loaded. If you're loading your muscles, you're loading bone because they're attached.
Right. If you're thinking about getting into strength training, I think this is really important. As we get older, lots of people do cardiovascular exercise, but I think strength training is key to kind of reduce that loss of muscle that we experience, as well as our loss of bone. If you're unfamiliar with some of the exercises or the techniques, please seek out a professional like a personal trainer or someone at your gym or at the Y or whatever to show you how to do the exercise properly, because you don't want to get injured. And start slow.
You could get injured if you're not careful, but those are definitely shown to help bone mass.
There you go. That's number 2. Number 3.
Next one is a balanced diet plus or minus some supplements.
Okay.
And now, the key things in a balanced diet that we talk about for bone health are calcium, vitamin D, protein. You've heard of zinc, magnesium, and collagen.
Gee, wow, you went through all of them right there.
Well, I thought we could break, that was the introduction.
I like it.
That was the introductory paragraph.
Okay, I like
now
it.
we're going to break it down.
Okay, you're grade 7 writing an essay.
Calcium, vitamin D, protein, those are no-brainers, can I say?
Yes, I would agree.
Those are all truths.
Okay, so let's talk about calcium. How much calcium should you get?
The daily required intake of calcium is 1,500 milligrams.
Yeah, so it ranges depending on your age, somewhere in that 1,000 to 1,500. Ideally, we've done other videos about this. You want to get it from your diet, so low-fat dairy, green leafy vegetables, almonds, things like that. Supplements, if you've already had a fracture or you've been determined to have an inadequate calcium intake. Vitamin D.
Calcium was tricky because we used to promote supplements and that went away when it sort of found to be contributing to atherosclerosis.
Yes.
Like that. Remember, you could get orange juice with calcium in it, and that went away.
Yeah.
So there is some.
I think there are still some fortified ones.
But there are some issues with too much calcium intake.
Totally agree.
Check with your healthcare provider on that one.
Yes. What about vitamin D? We're getting it from the sun?
No, we get it. The sun helps us get vitamin D, but where we live, we don't get enough vitamin D.
Right.
Most people don't get enough vitamin D from the sun, so supplements are often recommended. However, too much vitamin D, because it's fat soluble, can be harmful.
Right, so a couple things about vitamin D. Recommendation is 800 to 1,000, and as we get older, our absorption gets worse and we need more, so check with your doctor, potentially have your levels checked, so you may need more than that. Number 2 is vitamin D, as you mentioned, is fat soluble. When you are taking a supplement, there have been good studies to show that if you take it with a small amount of fat, it's like a couple of nuts even, like 5 grams of fat, this can increase your vitamin D absorption by up to 50%.
Right.
So if you're looking to get the most bang out of your vitamin D buck, have a couple nuts with it.
Right, you're nuts.
You're
nuts if you take too much vitamin D. You have to be careful. There has been some recent stuff in the news now about vitamin D toxicity and that.
And there are lots of people that are taking 10, 15, 20,000. And interestingly, they've done randomized controlled trials to see if hyperdosing of vitamin D increases your bone density more than meeting the normal requirements, and studies have not shown this to be universally useful. So yes, proceed with caution, be sensible, right? Everything in moderation.
And vitamin D, those are measured in IU, international units, as opposed to milligrams.
And then the third core one was protein. And we've learned more and more that we definitely need to meet our protein requirements for a host of reasons. As we get older, our protein requirements can increase slightly, as well as our diets often get worse because a lot of people can't afford or don't cook or more animal-based products that have dense sources of protein. So be aware, because collagen is like the main protein in your bone. It makes up like 95% of your bone matrix, where the calcium and the phosphate are kind of hanging on to it. So you need adequate protein to build your bone.
Then you get those other ones. You get your zinc, your magnesium, your those are like the fringe beneficial ones. Okay, those are the ones when at recess they're like the last picks.
The lunatic fringe.
Last picks for the foot hockey game, you know, that kind of stuff. So zinc, there's some evidence to suggest zinc
supplementation. Agreed, especially if deficient.
And magnesium is the same. Although magnesium's also got its other effects, sleep aid and digestive aids, which we've talked about in other videos. And then collagen. That's when I've always told people there's no evidence to take collagen.
Right. So I used to say the exact same thing. I would say for cartilage growth, I'd say there's no evidence, but there actually are some RCTs that look at people that were taking 5 grams of collagen a day. This did increase their bone density 1-2% over the course of a year. Particularly, most of the studies are on postmenopausal women, because this is a group of patients who definitely are prone to fractures and osteoporosis. So worth considering. There are some issues potentially with abnormal thyroid function because of the nature of the amino acids that are present in collagen. So if you are going to take it, discuss it with your doctor, make a decision for that.
And we're not talking about collagen for osteoarthritis.
No.
We're not even talking about osteoarthritis here.
No.
Osteoarthritis is inflammation in the joint, as opposed to osteoporosis, which is a reduced bone mineral density and increased risk of fracture.
Okay.
2 different things.
So, number 4, consistent with our pillars of health that we've talked about in the past with a bunch of different guests, avoiding alcohol, potentially down to 0 consumption, because alcohol reduces both your estrogen and your testosterone. So these are intimately linked to bone growth and bone remodeling. So avoiding alcohol, quitting smoking because of the chronic inflammation.
A lot of people just swept away when you said
After alcohol?
Yeah. They just swept right off our video.
I think
You should save that one for the end.
I think more and more people are recognizing, though, that I think people know that it's not good for you per se. So I think people are grossly dialing back the amount that they drink, but I think some people are willing to still accept that risk.
Okay.
Smoking, obviously it's not good for you for a host of reasons, but a lot of people don't think, oh, that's bad for my bones. That chronic systemic inflammation that it leads to definitely has a negative effect on your bone density. And then the last one, kind of asterisk, is caffeine.
There you go.
Yeah.
Can't drink alcohol, can't drink coffee.
So I would not say don't have any caffeine, but beware that if you are having a meal that has calcium, don't drink the caffeine with it because it can reduce the absorption of calcium. The same goes for iron, actually. So you probably should not, if you're going to have like soda or something that has caffeine, maybe don't drink it with your meal, drink it either before or after. The timing is important.
If you're at the bar, the rum and coke,
Yes.
they should rename that one to the bone breaker.
The bone breaker.
You got your alcohol and you have your caffeine in one drink.
There you go.
Smoke a cigarette with that, you might as well snap your wrist on your way out.
Okay. So that's 4. Number 5. This is the big one.
I mean, hormone replacement therapy in postmenopausal women is controversial. We're not going to discuss that, all those controversies now. However, hormone replacement therapy has been shown to increase bone mass in postmenopausal women. And it's one of the reasons why you would consider taking hormone replacement therapy.
So I'm going to talk about the controversy just a tiny little bit.
Are you?
Yeah, just because what happened in early 2000s, there was one study that was arguably nowadays accepted that it was misinterpreted.
The breast cancer
study. So the Health Initiative, the Women's Health Initiative was a massive study and it showed there was a slightly increased risk of breast cancer in women taking HRT versus non-HRT. People went back and reanalyzed it and said, you know what, it's probably not a real finding. And that the benefits probably outweigh. So this is definitely something worth talking to your family doctor about. But what it has shown is that once you are postmenopausal, you're losing bone at a rate of 1-2% a year. The first 5 years are the most aggressive loss. So HRT in the early years is certainly most important, but you can get benefit out to 10 years. So say you're 3 years into menopause and you're like, oh man, I missed my window. You haven't. It's worth considering because the benefits are very, very real. Unfortunately, once you stop HRT and remove that estrogen, you will continue to lose bone at a regular rate. So you have to discuss whether or not you're going to keep taking it because the risk is lifelong.
And so if you're a postmenopausal woman not taking hormone replacement therapy, you don't want to become an astronaut.
No, definitely not.
You do not want to be drinking a rum and coke, smoking a cigarette on the way up.
No, you definitely do not. Similarly, for hormone replacement for men, if you are testosterone deficient or if you have low T, TRT is been shown to increase bone density, and osteoporosis is just not an issue for women. It is common in men, even up to like 1 in 7 men. And they say that hip fractures in elderly men actually have greater morbidity and mortality, ironically. And we see lots of men that break their hips.
There is a significant morbidity and mortality associated with hip fractures.
Yes.
Depending on your age and your comorbid conditions, it can be quite high, like almost 50% 1-year mortality, depending on what you have.
Which is shocking to most people.
Yeah.
And the best way to do it is keep your bones strong, keep your muscles strong, keep your coordination to avoid falls. And then
the average person has a much lower mortality associated with hip fracture, but if you have a lot of comorbidities and you're quite advanced in age, there's a high mortality associated.
So the take-home message for number 5 is, if you are deficient in estrogen or testosterone, it is worth a conversation with your family doctor to say, hey, am I a candidate? What are the risks? What are the benefits? Go from there.
Okay.
Good. Okay, the last one.
In keeping with the controversy theme, Big Pharma got in there. Said, we want a piece of the pie.
Right.
Bisphosphonates.
Bisphosphonates. And
medications to take for osteoporosis.
And I'd say this has been a change from when we were first training, right? These medications have slowly evolved, and we had inferior ones before. I would say the research is unequivocal that bisphosphonates work very well for increasing your bone density. So typically they're prescribed if your bone density is minus 2.5 standard deviations below the norm, or minus 1 standard deviation, and you've had an insufficiency type fracture of your wrist, your hip, or your back. But they definitely 100% grow bone. However, there are some associated risks. Ironically,
my favorite risk of a medication is the risk of atypical femur fracture for taking a medication that's supposed to prevent fracture.
I feel like they just kind of moved the fracture just a little lower down the femur.
It made it a little trickier to treat. So that was one of the things. There was some class action lawsuits that came about from the medications that were supposed to reduce your risk of fracture. However, one of the complications associated with taking those medications was a femur fracture. You heard it right. That's what I said.
So wait, you're trying to prevent a femur fracture, proximal femur fracture, but you cause a different kind of femur fracture?
Yeah, we called it atypical. It's atypical.
It's weird. Yes, and as well as osteonecrosis of the jaw is another one that is not super common, but obviously a big problem for the people that get it. So they've talked about how long are you on this medication? Is there a benefit of a drug holiday? Does that help? Does that help reduce the risk of these atypical complications? So definitely worth a discussion with your doctor or your endocrinologist if you're seeing someone specifically, because often they're involved. But if you have done everything in our first 5 and you had multiple fractures and you're high risk, this is still something that can play a very important role and does for many people in reducing the risk of getting fracture.
Many people are on this and they have seen a reduced risk of fracture being on these medications. However, like any treatment, like any medication, there's a risk-benefit ratio. And in the majority of the time, the risk-benefit ratio favors being on this medication for certain people. But just like taking an aspirin has a risk associated with it, of a GI bleed or something like that, there's a risk with every medication. However, that was number 6. Medications to help with your osteoporosis.
Wow, that's a lot.
It's a mouthful.
And as orthopedic surgeons, it's something that's part of our daily lives. So it's important to us, it's important to our patients, and now you guys know. So if you like this video, please like it, subscribe to the channel, share it with someone that you know that has low bone density and is maybe not doing some of the things on our list.
But tell us about your fractures that you've had as a result of bone mineral density decrease.
And if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. Turns out you're in charge of your own bone mass too.
We'll see you next time.